Assalamu alaikum and good morning to one and all. Today we'll start with a new chapter, that is Pharmacology of Local Anesthetics. I am Sheikh Abu Sufyan. Welcome you to my YouTube channel Pharma Learning Forever. At the end of this e-learning session, you are able to define and classify local anesthetics, differentiate local and general anesthetics, and discuss its mechanism of action. So let's start with the definition of local anesthetics. So the local anesthetics, these are the drugs which upon local application, it produces or it causes reversible loss of sensory perception and especially of the pain in a restricted area of the body. So if you compare the definition of local anesthetics with general anesthetics, then there are two important things. So first thing is that the local anesthetic you have applied locally. Okay, so the application of local anesthetics, it is at particular area. So we call it as the local application, and what it does, it causes reversible loss of sensory perception, especially of the pain in a restricted area of the body. So this is second important thing, that it doesn't produces loss of sensory perception in entire body, that is what done by the general anesthetics, but it produces loss of perception especially of the pain only in the restricted area where you have applied local anesthetics. Okay, for example, if you are undergoing the dental surgery, then in dental surgery it is not expected that you need complete loss of consciousness. Means you don't want complete body to undergo the loss of sensory perception. So you are doing surgery or you are just removing teeth or doing teeth extraction at particular area. So there just you give the injection of local anesthetics so that the perception or pain sensation of only that particular area can be blocked, and you can have the tooth extraction or removal of the teeth, or you can do the minor surgery which is related to your oral cavity. Okay, so this is the difference between the local anesthetics and the general anesthetics. So this is the definition. Let's move and now we'll see what is overall difference between general anesthetics and local anesthetics. So as a pharmacist, you must know this difference, because based on the requirement of the patient, the disease of the patient that he is suffering from, as a pharmacist, you must be in position, especially if you are working in the as a hospital pharmacist, to guess or to judge that in which condition the local anesthetics are required and in which condition the general anesthetic can be given to the patient. Okay, so the difference between general anesthetics and local anesthetics is, so the general anesthetics in terms of site of action, so we'll be seeing this difference based on different parameter. So the first parameter, it is the site of action. We know that general anesthetics, they act on central nervous system, so the drug has to be lipid soluble, it has to reach to the brain in order to produce the pharmacological action. So site of action here, it is CNS, whereas in case of general anesthetics it is peripheral nerves. So it produces effects only on the peripheral nerves. There is no need to reach the drug at the central nervous system. So the site of action, it is different. General anesthetic, it is CNS, whereas in case of local anesthetics, these are the peripheral nerve which are present at the site of application. Okay, this is the first difference. Second parameter, in terms of area of body involved. So we know that in case of general anesthetics, once anesthesia is induced, the whole body is involved. So you can carry out surgery at any part of the body, because complete body it is involved. Due to the general anesthetics, there is complete loss of sensation. Okay, whereas in case of local anesthetics, only restricted area of the body it is involved, complete body it is not involved. So whenever you want to perform the minor surgery at particular area or particular part of the body, so there just you apply local anesthetics or give injection of the local anesthetics, so that you can paralyze or you can reduce perception of the pain in that particular area only. So area of body involved here, it is whole body, whereas in case of local anesthetics, restricted part of the body it is involved. Third parameter, it is consciousness. In case of general anesthetics, we have seen that loss of consciousness it is required, especially in case of the surgical grade of anesthesia. Okay, so loss of consciousness it is must. So consciousness, it is lost in case of general anesthetics, but in case of local anesthetics, consciousness remains unaltered. So the patient can see what is happening with his body, what procedure has been conducted, he can feel that. Okay, so here there is no loss of consciousness, which remains unaltered in case of local anesthetics. Next difference, it is in terms of care of vital function. In case of general anesthetics, since we are giving the drug through either inhalation or we are giving the drug through IV injection. Okay, so inducing agent we are giving through IV injection. So in both the cases, our drug has, it is going into blood circulation. So since drug it is going into the blood circulation, your all vital organs like the heart, your central nervous system, so most of these organs are involved. And since these organs are involved in this process, you do remember that there is very essential to take care of the vital function of, or the care of vital organ, it is very necessary, because since drug it is in a blood, it can expose to the heart, it can expose to the lungs, it can expose to the brain, so it is exposing to all vital organs. So in such cases, if drug is having specific toxic effect on particular organs, then you must take specific care in those patients. So care of vital function is essential in general anesthetics, whereas it is not needed especially in case of local anesthetics. Okay, fifth parameter, that is poor healthy patient. So giving general anesthetic, it is always risky because you need to control general anesthetics, and sometimes we have seen different grade of CNS depression where patient can move from stage of surgical anesthesia to the medullary paralysis and death of the patient. So poor health patient, general anesthetics are always risky, whereas in case of local anesthetics, they are safer because you are not exposing drug into the blood circulation. It is not going into systemic circulation. It is just applied at the particular area. So all organs are not involved. So poor health patient, it is risky. Local anesthetics are safe as compared to general anesthetics, especially in case of poor health patient. Next parameter is in case of use in non-cooperative patient. So there are some patients who are very non-cooperative. So you can use general anesthetics. So such patient can be made unconscious through loss of consciousness, right? And you can perform the surgery. But in case of local anesthetics, the problem is that you cannot perform the surgery by simply using local anesthetics because these patients are non-cooperative. So in case of non-cooperative patient, the general anesthetics, it is required, whereas in case of local anesthetics, it is very difficult to perform even minor procedure in case of the non-cooperative patient. So this is the next parameter. Then major surgery, obviously we perform the major surgery under the influence of only general anesthesia. We are not doing any major surgery like cardiac bypass, then organ transplantation by using simply local anesthetics. So for major surgery, general anesthetics are preferred. Whereas in case of local anesthetics, they cannot be used. So we are not using local anesthetics. So do remember that the major surgery always the drug which is used belong to the category of anesthetics are general anesthetics and not local anesthetics. Whereas it is exactly opposite to minor surgery. So minor surgery, general anesthetics are not preferred because why to unnecessarily expose the different organs to the drug. Okay, so what you can do in case of minor surgery, you can simply use the local anesthetic. So local anesthetic are generally preferred in case of the minor surgery. So this is the difference between the local anesthetics and the general anesthetics. So based on this, you can take the decision that, or you can say that the local anesthetics are specially used in case of the minor surgery, where you are doing procedure only at a particular area where you are not giving major incision. Okay, so that is important difference between the local anesthetics and general anesthetics. Let's see next part, that is the classification of local anesthetics drugs. So the local anesthetics, they are classified as injectable anesthetics and surface anesthetics. So they are broadly divided into injectable and surface local anesthetics. So first we will see the different classes belong to the category of injectable local anesthetics. So injectable local anesthetics, they are classified into different category based on their potency and their duration of action. Okay, so do remember those drugs which having the low potency. So those drugs which having low potency, they also having short duration of action. So we'll see at least two example in each category. So the low potency short duration of the action, example it is the procaine, and second example it is the chloroprocaine. Okay, so this is the drug belong to the category of low potency and short duration. So obviously if although it is a minor process which required very short process, or which require very short duration to perform that, then in that case low potency short duration drug can be used. Okay, so for example, if you simply want to give the stitches to the injury, then here there is no need to give even drug belong to the category of moderate potency and moderate duration. So the low potency short duration drugs are sufficient. Okay, so this is first category. Second category, it is intermediate potency. Since it having intermediate potency, the duration of action it is also intermediate. So the drug belong to this category. It is a lidocaine, lignocaine. Okay, so lidocaine it is also called as the lignocaine, or second drug it is the prilocaine. So you can see most of these local anesthetics, they are ending with the suffix caine, that is cane. Okay, so even here in case of they are ending with the suffix caine. So it is easy to recognize that the drug it is local anesthetics or what is their category. So based on their suffix you can also identify, yes, this is the drug belong to the category of the local anesthetic. So this is the second category, that is intermediate potency and the intermediate duration. Third category, it is the high potency. Now since this drug having high potency, their duration of action is also long. Okay, so these are the drug called as high potency and long duration of action. So the drug belong to this category, it is tetracaine, and second one it is the bupivacaine. Okay, so the tetracaine, bupivacaine, the ropivacaines, these are the drugs belong to the category of high potency and long duration. So based on the time which is needed for performing the minor surgery, you can select the drug belong to the category of either low potency short duration, or intermediate potency and duration, or high potency and long duration drug. Okay, so these are the drug belong to the category of injectable anesthetic, means you are giving local injection of this drug. You are not giving this injection in systemic circulation, you are giving just simply local injection at the part where you want to perform the surgery. For example, in case of tooth extraction, you are giving the injection on in a gum part. So gums you are giving the simple injection, right? In case of minor problem which is related to the skin, the stitches and those things, so you are giving just subdermal injection of these local anesthetics. So you see that you are taking care that the drug it is not going into systemic circulation. So although it is injectable, it is so you but you still ensure that it is not going into systemic circulation, so that their local action can be restricted. But although we try to do this, but still some of the drug can also go into systemic circulation. Okay, so this is the first category, that is injectable anesthetics. Let's see the second category of local anesthetics, that is surface anesthetics. So the surface anesthetics, these are the drug which are further classified it into the two different category, like solubles surface anesthetics and insoluble surface anesthetic. So the soluble surface anesthetic like the cocaines and the lidocaine. So these are the drug which are simply you are going to apply it on the skin. So then tetracaines and benoxycaine. So some of these drugs are also be given through injectable anesthetic. For example, we have seen the lidocaine as intermediate potency and duration drug, and which is also given by the injective as an injectable dosage form. Okay, but you can use it as a surface anesthetic also, because since it is soluble, you can make its ointment, or you can use the powder form of this drug, and you can simply apply at the part where you want to perform the surgery. Okay, so this is in case of soluble surface anesthetics. Second one, it is insoluble surface anesthetics. So these are the drug like benzocaines and butyl aminobenzoates. So this is the second category. Only difference is that the first category it is soluble in the water, and second category like benzocaines and butyl aminobenzoate, these are not soluble in the water. So accordingly you can decide what dosage form it is to be created. Since those which is not soluble in the water, especially you prefer the emulsion and the lotions. Okay, so you can make it so that that can be applied at the part where you want to perform the local surgery. Okay, so this is about the classification of the local anesthetics, which is very important, the aspects amongst the local anesthetics chapter. Okay, Third thing, it is about the chemistry of the local anesthetics. So local anesthetic has very interesting chemistry, and each molecules in the local anesthetics, it contribute to their different properties. Let's see how it is possible and how you can play around that, and you can design different local anesthetics with a different property. So that is very important, because as a pharmacist, one or another day, if you are going to invent or if you are going to investigate the new local anesthetics, then you must know what are those components that can be changed, so that you can get some the better the effect of the drug, and to get the better safety of the drug. Okay, so do remember that the local anesthetic, these are the weak bases with amphiphilic property. So weak bases means it having some group which are basic in nature. So we'll see that when we see the structure. And second important thing that must be remembered, it is amphiphilic in nature. Now we'll see what do you mean by amphiphilic nature or on amphiphilicity. Okay, so for that I have just posted here you one local anesthetic. So this is the structure of the local anesthetics. So if you see this structure, then you can see here the local anesthetics are divided, their structure is divided into three parts. So the first part, it is the aromatic ring. Okay, second part, it is the intermediate chain, and third part, which is generally the amino group, it is present. Okay, so like NC, this is the diethyl amino group, so it is present. Okay, now let's see what significance contribution this group gives to the local anesthetics. So we'll first see about the aromatic group. So this is aromatic group, which is the generally the unsaturated ring is present, then it is called as the aromatic group. So this aromatic group, it provides lipophilicity to the local anesthetics, right? And we know that we apply local anesthetic for local action. We don't want local anesthetics to go into the brain. We don't want local anesthetic to cross the systemic circulation, right? So if this aromaticity, if it is more, then obviously it is going to increase the lipophilicity of the drug. And if this lipophilicity, if it increases, then this drug can diffuse across the membrane, because our all the membranes are lipidic in nature, right? So it can quickly diffuse across the membrane, and it may contribute to the toxicity of the local anesthetics. So the toxicity, it is increased in parallel with the lipophilicity of the local anesthetics. So as a pharmacist, if you are designing local anesthetics, so you see that the aromatic group, it should be such that it should not contribute to the, it should not much contribute to the lipophilicity of the drug, right? So as far as possible, the local anesthetic should be the less lipid soluble in nature, or there must be proper balance between lipophilicity and hydrophilicity, right? So this is the first group, that is the aromatic group, and it contribute to the lipophilicity. Since contribute to the lipophilicity, so if there is increase in the lipophilicity, the drug may diffuse across the membrane, and it may increases the toxicity. So while designing, you must see that your drug should be less lipid soluble in nature. Second part, it is an intermediate chain which can connect your aromatic ring with the amino group. So this intermediate chain can be the ester or it can be the amide. So here in this structure, the intermediate chain, it is the ester, because C double O CH2 group is there. It is the ester structure. Okay. Now this intermediate chain, it's just connecting lipophilic group with the hydrophilic group, whereas the third group, it is present, it is the amino group, and this amino group, it contribute to the hydrophilicity, right? So in the same drug there are in same drug there are two natures, that is lipophilicity and hydrophilicity. So drug, it is one, but it having both lipophilic and hydrophilic nature, so such drug they are called as amphiphilic, right? Because it having both the drug, like amphibians. So amphibians are those who live in the water as well as the land. Likewise here, the amphiphilic are the drugs which are hydrophilic as well as lipophilic in nature. Okay, so this the mixed nature, it make local anesthetic amphiphilic in nature. Second important thing we have seen, these are the weak bases. Now which group is contribute to the weak bases here? It is the amino group. So do remember, the amino groups are always basic in nature. Likewise, so here also there is nitrogen, here also there is nitrogen, it is coming. So these contribute to the basic nature of the local anesthetic. So they are weak base in nature, which is due to the amino group present in the local anesthetics. I hope the chemistry is clear to you. Another aspect about the chemistry is that in case of nitrogen, if you add more group, then there will be increase in the charge. Okay, so because nitrogen valency is just 2, so if the third structure if you add, or fourth group if you add, then it become a quaternary amino group, and there is will be addition of the charge. Now let's see what is the significance of the charge. So if there is charge form of local anesthetic is there, then such charge form of local anesthetics, it is a major active form, means it show more activity as compared to the uncharged form of local anesthetics. Okay, so these are the different aspects of the chemistry of the local anesthetic. So if you can play around this chemistry, and then you can able to design ideal local anesthetic. Like to overcome the toxicity of the local anesthetic, we have to see that the local anesthetic should have less lipid solubility. So accordingly, you can add here structure which can produce the less lipid solubility, right? Likewise, in case of the charge form, if you want more active drug, then you can add more groups so that valency of this drug can be increased and it become a charge form, so that such drug can be a more major active form of the local anesthetics. Okay, so I have done with the chemistry. So before going ahead the second part of today's session, let's have the quick question and answer. So the first question is, how local anesthetics are different from general anesthetics in terms of their site of action? We have seen different parameters where the local anesthetics are different from general anesthetics. One of the parameter, it is site of the action. So how they are differ from each other in terms of site of action. So let's see who give first answer. Okay, so I can see the answer started coming. Sadia has given the first answer. She mentioned that in case it act on peripheral nervous system, yes, local anesthetics act on peripheral nervous system. Nazia mentioned that general anesthetics act on the CNS. Okay, so the site of action it is different. General anesthetics it is the CNS, and local anesthetics it is peripheral nervous system. I have seen the response or answer from many students, but still I can see the response is very slow. I hope you are active and you are not sleeping in the lecture. Okay. So site of action it is CNS in case of general anesthetics, and it is especially the peripheral nerve in case of local anesthetics. My next question is, give one example of soluble surface anesthetics. So we have seen the two example of soluble surface anesthetics. I want you to give at least one example of soluble surface anesthetics. So here we are talking about surface anesthetics. We are not talking about the injectable anesthetics. Okay, so first answer it is given by the Jihan. He has mentioned about the cocaine. Sadia has given second answer, that is lidocaine. Okay, so the cocaine, lidocaine, benoxidate. Okay, again Sadia has given that answer. Okay, so especially the cocaine and lidocaines are the well-known the soluble surface anesthetics that you can remember. So they belong to the category of the soluble surface anesthetic. They are water soluble in nature. Third one, which group of local anesthetics it contribute to the lipophilicity and toxicity? So we have seen in the last slide that various different groups are there. Out of that, which group it contribute to the lipophilicity and toxicity of local anesthetics? Okay, again, I have seen the Shah Altaf, Sadia, Sufreen Banu, Vedant, okay, Ghulam Ahmad, Roma. Okay, they have mentioned about the aromatic group. Okay, so it is the aromatic group which basically contribute to the lipophilicity of local anesthetics and increase the lipophilicity. Such drug can cross the membrane and it can goes into blood circulation. Whereas you don't expect their action in the blood, you want just local action. So obviously, when drug goes into the blood circulation, it may contribute to their toxicity because it is exposed into the different organs. Okay, so we have seen that it is the aromatic groups which play or which contribute to the lipophilicity and toxicity of the local anesthetics. So let's move on to the next part of the local anesthetics. So we have seen that based on the intermediate chain. Intermediate chain which is present, it might be amide or ester in nature. So we have seen what is the use of the aromatic group and the amino groups. Amino group, it contribute to the weak basic nature, whereas your aromatic group, it contribute to the lipophilicity, right? Whereas intermediate chain, we have not seen what is their significance. So based on intermediate chain, whether it is amide or it is ester, the local anesthetics can be the amide local anesthetics or ester local anesthetics. Okay, so out of this, the amide local anesthetics having many advantages over ester local anesthetics, and that is the reason why you prefer using amide local anesthetics. We'll see what are those advantages given by this intermediate chain amide local anesthetics as compared to the ester local anesthetics, so that accordingly you can select appropriate drug as a pharmacist, or when you are investigating the new molecules, you can see that you are dealing with the amide local anesthetics, okay, because it having more advantages. So the first advantage is that it produces more intense. Now let's see what is the reason why it produces more intense and longer lasting anesthesia. So obviously when we talk here about anesthesia, it is the local anesthetics. So we are not talking about the loss of consciousness. Only particular part is loss of consciousness. Okay. So it produces more intense and longer lasting anesthesia because it binds to alpha 1 acid glycoprotein in the plasma. Now when drug is bind to alpha 1 acid glycoprotein in the plasma, or any drug when it bind to the plasma, always remember that that drug, it is not available in free form in the blood. Okay. Now since this bind to alpha 1 acid glycoprotein in the plasma, it is not hydrolyzed by the plasma esterase because drug, it is present in the bound form. The plasma esterase is the enzyme which causes the breakdown of the ester group. Now it is very predominant in a plasma. Since it is predominantly present in a plasma, if you design the ester local anesthetics, since ester local anesthetics, they doesn't much bind to the alpha 1 acid glycoprotein, they are freely available in the plasma, and where it will undergo the process of hydrolysis in presence of enzyme called as esterase, right? Whereas esterase doesn't affect amide local anesthetics because the esterase, it is the enzyme which only break down the ester group, right? So this is the another reason why the amide local anesthetics, they having more intense and longer lasting anesthetic action because amide local anesthetic bind to alpha acid glycoprotein and they are not hydrolyzed by the plasma hydrolase. Okay, so that is the reason why they are having more intense and longer lasting anesthesia. Second thing is that they rarely causes hypersensitivity reaction, whereas it is seen that in case of ester local anesthetics, the risk of causing hypersensitivity reaction, it is more. So it is more in case of ester local anesthetics, whereas it is less in case of amide local anesthetic. So that is the basic advantage, that because hypersensitivity reaction is not a comfortable one. So the patient will suffer from discomfort due to hypersensitivity reaction. So it is rarely caused in case of amide local anesthetics. Then there is no cross sensitivity with the ester local anesthetic. Suppose if you are using or some patient who are allergic to the ester local anesthetics. So maybe you did some study or in the history when you have seen about the patient, you found that that patient, it is allergic to the ester local anesthetics. It doesn't mean that it also allergic to the amide local anesthetics. Why? Because it does not having the cross sensitivity. So there are some general anesthetics, if they having particular adverse drug reaction, then other general anesthetics, although the chemical class it is different, but they have the similar type of side effect. But that is not the case in case of the amide local anesthetics, because they does not have cross sensitivity with the ester local anesthetics. So these are the advantage of using amide local anesthetics over ester local anesthetics. Or this could be the answer why the physician or anesthetician he prefer amide local anesthetics over ester local anesthetics. Okay, let's see the mode of action of the local anesthetics. So before understanding their mode of action, that is, it causes the block of sodium channel, and we'll see what are the different things happens after block of the sodium channel. Now first we'll see how membrane it is present, and in case of normal case, and what happens when there is entry of the sodium, because this drug will block the entry of the sodium. Okay, so do remember that in case of normal membrane, outside there is always positive charge it is present. So the normal membrane, outside there is presence of the positive charge, and inside there is presence of the negative charge. Since both charges, positive and negative charges, are present, so there are two pole. One it is positive pole and second one it is the negative pole. So such membrane are called as the polarized membrane. So this is one of the state of the membrane, and that is called as polarization. Why we call it as a polarization? Because here the outside the membrane is positive charge and inside the membrane there is negative charge. So you call this membrane as a polarized membrane. Now what happens when there is a generation of the action potential? So in order to generate action potential, there must be the entry of the sodium from outside to the inside, or there must be change in these charges. So when the sodium it is entered inside the membrane, now what happened due to that? Suppose here sodium it is entered and sodium it having the positive charge. So slowly this negative charge become a positive, because sodium it is the monovalent cation, it having the positive charge. So when there is influx of the sodium inside the membrane, inside the membrane there is positive charge, and this process it is called as depolarization, because initially when outside positive is there and inside negative is there, two poles are there, so you call it as a polarization. Okay, but when sodium it is enter, it reduces the negativity inside the membrane, and this condition it is called as the depolarization. Okay, so this is called as depolarization. The moment sodium enter and the moment there is depolarization, there is generation of action potential. And basically the action potential it is nothing but a current which carries the message. And if there is no action potential, or when the action potential is generated, the message will be conveyed to the brain. I will give you a simple example. Suppose if you are sleeping and I have put your hand on hot plate. Okay, so what will happen? Obviously when to the extent when you are not completely get up from the sleep, but still the immediate action you can see in your hand, that you will be immediately removing your hand from that hot plate. Why it happened? Because when there is feeling of the excessive pain or feeling of the hot sensation, at that time itself there is generation of the action potential, because the message to be carries to the brain. So this is how it works. So there will be entry of the sodium, and due to entry of the sodium there is generation of the action potential, and through this action potential the message of that pain is conveyed to the brain, and now brain has replied back through your effector organs, right? And what you did, you have removed your hand. So although it happened in a fraction of second, but this is how message it is conveyed to the brain through the entry of the sodium or positive charge inside the membrane. So there must be the depolarization in order to convey the message. Okay, now what these drugs are doing? So these drugs they block the sodium channel. Now due to blockage of the sodium channel, there is no generation of the action potential. Now if there is no action potential, obviously no depolarization, and if there is no depolarization, then message will not be conveyed to the brain. Okay, so it blocks sodium channel, and due to blockage of the sodium channel, influx of the sodium ion into the neuron it is inhibited, right? And since there is inhibition of the influx inside the membrane, so since sodium ion it is not coming inside the neuron, it reduces the depolarization of the membrane in response to action potential. So there is no depolarization, right? So message it is not coming, so it will it not convey. So since there is reducing the depolarization, so as a result of that, it prevent propagation of the action potential, because to propagate action potential there is need to have the depolarization. But what these drugs are doing, they reduces the depolarization. So it doesn't propagate the action potential. So what do you mean by propagation? So do remember that suppose this is the action potential, right? So if it is generated, then this action potential, it has to be conveyed to the brain in order to take some logical action through the brain, or to the brain to respond, isn't it? Like feeling of the pain sensation, it is also happen through the brain. Now what is happening here, since you reduce the depolarization, there is no propagation of the action potential, or it can be the reduced accordingly, right? And due to this, the person will not feel the sensation of the pain, because the pain sensation, the feeling of that, it is not conveyed to the brain. So this is the mode of action. Second important thing about how it happened and how it process, so that we'll see one by one. So how does local anesthetics produces the conduction block? It's not like it happen immediately, right? It is the process. So the first thing is that as you increase the concentration of the local anesthetics, means when initially you apply the local anesthetics takes some time to reach to the neuron. Okay, so as time go ahead, there will be increase in concentration of the local anesthetics in the vicinity of the neuron. So as concentration of local anesthetic it is increased, the action potential and depolarization will decrease. And we have seen just now the role of depolarization that is needed specially for the propagation of the message. So due to that, there is slow conduction, or you can also call as the slow propagation of the action potential. So the conduction and propagation are both the same words. So the message will not be conducted towards the brain. So there is the slow conduction, and there is due to the slow conduction, the depolarization failed to reach the threshold potential, because in order to reach message towards the brain, there is requirement of certain threshold potential. For example, if you want to operate the fridge, you need the light of particular voltage. If there is dim light, you cannot operate the fridge. If you want to do the ironing, then there to start the iron, you also need good electricity, right? So to reach message to the brain, there is a certain level of threshold potential it is required. So if that potential, if it is decreased due to as there is increase in concentration, then it failed to reach the threshold potential, and due to that there is conduction block. So there is complete conduction block, or although action potential it is there, but it is not sufficient to carry the message of pain sensation towards the brain. Okay, so this is in my own word I have tried to explain you about how does local anesthetics produces the conduction block. So I hope it is clear to you. So basically what they are doing, they reduces the depolarization due to blockage of the sodium, and since there is a reduce in depolarization, there is slow conduction, it is not sufficient to reach threshold potential which is required for at least conduction of the impulses towards the brain. Okay, so this is about the molecule level mechanism of local anesthetics. So we'll see the day-to-day local anesthetics. Generally, if you have the minor injury, or if you are suffering from the pain, then as a home remedy, what you are doing, you apply the ice. So you are doing icing. So it is called the icing. So the local anesthesia can also be produced by the cooling effect. Now, how this can be produced by the cooling effect? Because due to cooling effect, it produces the conduction block. So, and due to the conduction block, it is produced due to the cooling effect. Even icing can also produces the local anesthesia. So you might have seen if you are suffering from the inflammation, if you are suffering from the injury, then you are doing the icing. So that is due to this reason. So you can directly apply ice, or you can use the carbon dioxide, snow, or you can use the ethyl chloride spray. So in case of some pain relief, the spray, if you see, when you apply those pain relief spray, the moment you apply, you feel the cooling sensation, isn't it? And through that cooling sensation, also some of the relief you get from the pain. So you are adding alcohol into that, so that it can evaporate, and it will give you a cooling sensation. So it is the indirect local anesthesia which is produced due to the cooling sensation through the icing, or the cooling of the body. So cooling also produces the local anesthesia by reducing the conduction block. So till now what we have studied about the definition, we have studied about the difference between local anesthetics and general anesthetics. We have seen the classification, then mechanism of action of the general anesthetics, and we have seen the home remedy of the producing the local anesthesia, or home remedy of the reducing the pain, that is through the icing, or we can produce local anesthesia by also using the carbon dioxide snow, which having very less temperature, and ethyl chloride spray. In next lecture, we'll study about the different drugs and their pharmacological actions and how they works and what are their effect on the different organs and the systems. Okay, so I've done with my today's session. I've referred KD Tripathi Essential of Medical Pharmacology, 6th edition. So this is the book that I have referred. I must thanks to the author of that textbooks. So thanks for watching my session. For more such learning, subscribe to my channel. And if you like my today's session, then do remember to give me a thumbs up.